Women's health is a journey that changes with every stage of life, and staying informed is key to overall well-being. This morning, we're talking with a board-certified OBGYN from Baptist Health System about common conditions and when it's time to call the doctor. So ladies, grab your coffee and let's get right into it. Dr. Michelle Muldrow, welcome.
Thank you for having me.
So what commonly happens at an annual Well Woman appointment?
So at a Well Woman, we typically see our patients once a year, and we kind of assess generally what's been going on. We'll do a physical exam. We kind of see what's going on health-wise. We'll do a pelvic exam, breast exam, and then go over the different screenings that are appropriate for their stage of life.
Got it. So we know the annual. Now, what are some other signs and symptoms we should call an OBGYN about?
So anything reproductive-wise. So if you're having any vaginal itching, pain, discharge, irregular periods, concern for fertility, concern for STIs, breast masses, pain, discharge, those are more the typical calls that we get or visits.
Got it. So any concerns? And what are the biggest health concerns for women?
Yeah, so that can be by stage of life. So typically our younger patients have concerns about their periods, missing periods, painful periods. Then as we move a little bit older, then people may be concerned about pregnancy or infertility. Then it's the screening, the pap smears, mammograms start at age 40. We recommend colonoscopies age 45. Menopause is typically about 50. And then as we get a little bit older, then we're more concerned about osteoporosis. So, different stages of life come with a little bit more priority in different topics.
Got it. Now, what is endometriosis and how is that treated?
Sure. So endometriosis is when you find the cells that are typically found inside the uterus or the endometrium that sheds during our period outside, which can be associated with a lot of pain, painful intercourse. Typically the pain is outside the realm of normal cramping. It can be debilitating.
Mm-hmm. So anything like painful, I guess, if you have those symptoms, because you may not even realize you have this.
Correct.
Got it. Okay. Now let's talk about perimenopause. What is it that no one is saying also about menopause that we should know?
Yeah. So average age of menopause is about 51, and that's basically a year's worth of no longer having periods, and that can be associated with hot flashes, night sweats, irritability, insomnia, vaginal dryness, painful sex, weight gain, mood issues, feeling a little bit more depressed, and so, but nobody wakes up at 51 and boom, you hit it. So there's a time frame, maybe about 7, even up to 10 years before then, where these hormones start to change because it's a decrease in ovarian function, so you have a decrease in these hormones. And so you might start to sneak into some of these symptoms. So you might notice you're waking up at 3 a.m. every morning. You're like, what is happening? You're a little bit moodier, your periods start to become irregular. And so those are things that you can certainly talk to your GYN about.
Okay, and like you said, that starts years before you hit 50, right?
Sure. It's a gradual change.
Got it. Okay. Well, you can take charge of your health and learn more about women's wellness from Baptist Health System. Just visit the website baptisthealthsystem.com/women's care or scan the QR code on your screen. They have expert insights, screening recommendations, and information on compassionate care options designed just for women. Thank you for all that information today, Doctor.
Thank you for having me.